Hi, this is Althea, and today I'm here to share with you a well-kept news. It is your boobs are your booze. Did you hear that? Your boobs are your booze. They are closer to you than your besties, and if you listen to the secrets they tell you about your breast health, you can put a squeeze on the number of women that die from breast cancer each year. At the end of this presentation, there are three outcomes. You will learn 1. The common signs of breast cancer. 2. You will get a better understanding of the disease. And 3. You will learn how to self-examine your breasts. Let's briefly go over the anatomy of the breast. The breast lies on the pectoral muscle at the upper part of the chest and is nestled with fatty tissue and erectile tissue covered with skin. Each mammary gland forms a lobe of the breast and consists of a major branch of milk duct and alveoli, which ends at the pore of the nipple. So the breast is the tissue overlying the chest or pectoral muscle. Women's breasts are made of specialized tissue that produces milk, which are also called glandular tissue, as well as fatty tissue. The amount of fat determines the size of the breast. The milk-producing part of the breast is organized into 15 to 20 sections called lobes. Each breast has several lobes that surround the nipple like spokes on a bicycle wheel. Inside each lobes are smaller lobes called lobules. At the end of each lobule are tiny bulbs that make milk. These are linked together by small tubes called ducts, which carries the milk to the nipple. So the dark area is called the areola, and it surrounds the nipple. And of course, the nipple is the external bulb of tissue from which a baby breastfeeds. Milk ducts are the tubes that milk flows through. The alveoli cells are clusters of cells that forms tissue that secretes milk. In this diagram, you'll see the main structures of the breast. The green items at the top are lymph nodes. The purple are milk glands. The yellow substances within the breast are fat. And the skin is the pinkish outer layer that covers the fat. The long tubes are milk ducts. Within the glands or lobes are small lobules. And the red tissue is muscle. Now let's get down to the signs of breast cancer that our breasts can tell us if we pay attention to what they're telling us. First one is lump or thickening of breast tissue. Next, pain in the breast and armpits. Another, breasts getting larger, one breast getting larger than the other. Next, puckering or dimpling of the skin that covers the breast. Another is inverted nipples. Yet another, nipples that has rash, crust, or produces discharge. Itching of the breasts, constant itching, that's not good. Redness or swollen breasts. Previously, I mentioned dimpling of the skin of the breast. This is manifested as tiny depressions or holes in the skin that gives the appearance of orange peel. A lump in the breast and armpit is one of the most common signs of breast cancer that is known. Another one that is not as known is inflammation. Inflammatory breast cancer takes on many faces. One is a sudden enlargement of one breast over the other, or it could be both breasts too. Inward turning of the nipple, pain and tenderness in the breast. Also, as I said before, swollenness and redness. So pay attention to these signs. If you see them, you need to seek medical help. Now turn your attention with me, please, and let us discuss the types and classification of breast cancers. There are, broadly speaking, 5 types. We have the there are basically 5 types. We have precancer or DCIS. Those are cells that may be cancerous later, but at the present time, they are not cancerous and we need to pay attention to them. The next type is non-invasive. Then we have invasive, followed by recurrent, and then the worst type, which is metastatic cancer. Now, those types of cancers are further subdivided into invasive ductal carcinoma, invasive lobular cancer, inflammatory breast cancer, tubular breast cancer, colloid breast cancer, and metaplastic breast cancer. And I guess we could also add in it the non-invasive ductal lobular. Okay, those are broad categories. Now, let's talk a little bit more about the stages of cancer. Stage 1, the tumor is small. It's less than 2 centimeters or 3/4 inch, and no cancer is in the lymph node. Okay? In stage 2, it's larger than 2 centimeters or 1 inch. There is no cancer in the lymph nodes, or if there are any cancer, they are very tiny and very few. All right? Stage 3, tumor is larger than 4 to 6 centimeters. There is cancer in the lymph nodes. There is inflammatory but not metastasized cancer. And chemotherapy, surgery, radiation, hormonal therapy can be used at that stage to lower the cancer from spreading. Now in stage 4, that's the worst stage. You don't want your cancer to be discovered when it's that bad. So in stage 4, the cancer has spread, or medical people will say it has metastasized, and it is growing in other parts of the body. So it evades the breast tissue and it spreads to surrounding tissue and other areas of the body. Usually it is when your cancer, your breast cancer, reaches this stage that patients usually die from it. In this stage, there is chemotherapy, there is surgery, there is radiation, sometimes hormonal therapy, and lifetime medication that is usually used. Okay? So in this section, I would like to speak to you about the risk factors of breast cancer. So some healthcare professionals might disagree with me, but I think just being a woman is a risk factor. Why is that? Well, 1 in 8 women will come down with breast cancer. Compare that with men. 1 in 1,000 men will have breast cancer. So right there, you see, just being a woman, you are at risk. So other factors, risk factors, are age. The older you get, the more risk there is of you coming down with breast cancer. Genes. There is a gene called the BRCA. BRCA1 and 2. Those are two genes that if you have them, the likelihood you'll have breast cancer is very much increased. Early menstruation. If you start your periods before age 12, that's an increased risk. Late menopause. If you undergo menopause after age 55. All right? Hormone therapy. There are certain hormones that can contribute to breast cancer. Certain estrogen medication. All right? Overweight. So obesity is a culprit. Certain birth control medications. And my understanding is it's especially the ones that have estrogens. Alcohol, dense breast tissue. Also, women that have never had a child or those who have a child after age 35. The last risk factor are Jewish individuals who have the Ashkenazi Jewish ancestry. Okay, healthy sleuths. Sam says, listen up carefully. So at this point, it is a good idea to take a pause, have a drink of water, and a bite of your favorite fruit or veggie. Now, let's turn our attention to common receptors identified in breast cancer. First, I will define them, which will help you to understand breast cancer more fully, as my goal here is not to bombard you with technical jargons or to confuse you, so don't go anywhere. During the discussion, you will hear me use some abbreviations and certain terms. The term BRCA stands for breast cancer, and you'll hear me mention BRCA1 and 2, so breast cancer genes. And these are types of cancers that grows aggressively and is likely to spread. R stands for estrogen receptor. PR. PR stands for progesterone receptor. HER2. HER2 stands for human epidermal receptor 2. Okay? The BRCA1 and 2 genes are mutated genes. In women, these genes increases the risk of breast, ovarian, and pancreatic cancer. In men, they increase the risk of prostate, pancreatic, and breast cancer. Now let's focus a little bit on what is meant by triple negative. So a triple negative subtype is when ER, PR, and HER2 receptors are negative. One of the abbreviation I neglected to tell you about is HR, and HR simply means hormone receptors. So all breast cancers can be subdivided into three categories: ER positive, HER2 positive, and triple negative. Okay, so HR, if the patient is HR positive and HER2 negative, also called luminal A, which is 73% of breast cancer cases. So that's the best prognosis if caught early. This is the most common in all races, age, and socioeconomic level. Now let's take a look at HR negative, HER2 negative. That makes up about 13% of breast cancer cases. This is the worst prognosis, and it is commonly seen in non-Hispanic blacks at every age, every social economic level, period. Now, it is also called triple negative, being triple negative. So this is something important here. This is an eye-opening for us. The next type, HR positive, HER2 positive, 10% of cases, and it is also called luminal B. This is seen in a small amount of the population, and it varies by state. So it's geographically varied. The last type is HR negative, HER2 positive. And again, 5% of the population has this type of breast cancer. It is also called enriched, HER2 enriched rather. Here are two breast cells. One is normal and one is cancerous. Normal cells can have HER2 receptors. The difference is one, receptor overexpression, and two, dysregulation of receptor activation. And that's the difference between the tumor cell and the normal cell. In the next two slides, you will see a picture of a HER2 positive breast cancer cell and an estrogen receptor breast cancer cell. Since HR positive, HER2 negative cancer makes up the largest percentage of breast cancer, over 73% according to one source. Let's give it a little bit more attention. According to this source, hormone receptors are proteins that receive hormone signals and cue the cancer cell to grow. If breast cancer cells get signals from the hormone estrogen that could promote tumor growth, it is known as estrogen receptor positive or ER positive cancer. On the other hand, if cancerous cells get signals from the hormone progesterone that could promote growth, then it is known as progesterone receptor positive, which is PR positive breast cancer. Breast cancer that is ER positive or PR positive falls under the category of hormone receptor positive or HR positive cancer. Now, HR positive cancer is usually treated with hormone therapies or a combination of hormone therapy and targeted therapy to help stop tumor growth first. There are more number of cases of breast cancer in women than those observed in men. Okay? Now let's discuss the treatment of breast cancer. It is important to note that a treatment plan is based on the stage of the cancer, the age of the patient, health cycles, type of the cancer, and the history of the patient. So treatments include chemotherapy, hormone therapy, surgery, immunotherapy, bone marrow transplantation, targeted therapy, radiation therapy, and it's important to also emphasize that the surgery is usually mastectomy or lumpectomy. Please note, a mastectomy is surgical removal of one or both breasts, while a lumpectomy is an incision that is made and removal of the lump and affected tissue. All right, thank you. If hormone therapy fails, cancer cells will multiply. If hormone therapy is successful, however, it will block receptors and slow growth of cancer tumors. So it is very important for a breast cancer patient to know their subtype so they can make informed decisions along with their physicians on their treatment options and to assess the likelihood of the cancer returning. Their family history and genetic information plays a vital role in this decision-making process. Self-examination of your breast is both a diagnostic and preventative tool. It's just one way a self-examination can be done. Standing up with the arms raised. So this is done on a monthly basis. Check each of your breasts and armpits with your arm raised. Use the pad of your fingers. Optionally, you can put some oil or Vaseline on your fingers and use it to check up and down in a wedge shape and in a circular motion, feeling for lumps in your breast as well as armpit. Use a mirror and look for lumps or dimpling of the skin. Also look for change in skin color and texture. Examine nipples for deformity, color change, buildup of crust, or leakage of fluid. Another way to check yourself is by laying down with your arms up. So you can lay on the bed and do the same motions I just described, going up and down, circular, and in wedges to check yourself. At your physical, or if you see your OBGYN, usually they do a breast examination for you. And on an annual or at least every 2 years, you should get mammograms. So, diagnostic tests done to find out if a patient has breast cancer includes a breast ultrasound or sonogram, diagnostic mammograms, MRI imaging, biopsies, staging, and cytological and other oncological studies. Here is a summary of what was covered in this discussion. The following items were discussed. The breast or mammary gland is made up of specialized tissues and elements such as the lobes, the lobules, the ducts, and alveoli cells. I told you women get breast cancer more than men at a ratio of 1 in 8 women and 1 in 1,000 men. The risk factors, classification, and types of breast cancer were also discussed. Also, the signs and symptoms were discussed. I gave a list of diagnostic tests and explained common receptors. And most importantly, you were introduced to how self-examination could be performed. Now, as I close this video, I hope you receive some form of value from watching the video. I would like you to subscribe to the channel if you have not done so already. Please like the video. Click on the notification bell so when a video is uploaded, you'll be notified. And thank you again for watching. I'll see you in the next video. Don't forget to subscribe to the channel if you have not done so already. Hit the notification bell and select all. Also give the video a thumbs up. And by the way, if you have not watched the video on stroke and the one on myocardial infarction, those are a must see. I'm going to link them on the end of this video. So please take a look at them and share them. Thank you.